talk about a leaky gut. Most of you have heard that term or you've seen it on the internet. And what in the world does this mean? It's a term I never heard of during medical school or residency. And really the research in this area is exploding right now. So I'm going to start this off by giving you a case to help make it a little bit easier to understand. So this is a case of one of my patients. He was a 14-month-old little boy, and mom brought him in because he was having constipation so bad that she literally would have to pull it out of him. And he was crying and screaming, and it was taking up a lot of their day, and they couldn't even leave the house. She'd been to the pediatrician and she'd been to a GI doctor, and he wasn't getting any better. So what we did is we went through, combed through those triggers of inflammation, you know them well, and we pulled dairy out of his diet and we added in a probiotic. And within a month, he was pooping, he was happy. They even took a trip during that month, and he still pooped on the road and during the trip. And what was happening is that dairy was creating inflammation in his gut. And we have a single layer of epithelial cells along our GI tract. So there's just one layer of cells between our gut and our bloodstream. The food goes in here and then it gets broken down and absorbed. And if we're eating a food, let's just use dairy as an example, and that creates inflammation, these nice cells that are supposed to have a very tight junction start to come apart. They get inflamed. And this inflammation then starts to allow food particles, food proteins, to get absorbed into the bloodstream. That then creates a cascade of inflammation. And that's where you start to see these symptoms that we've been talking about. Chronic runny nose, dark circles under the eyes, pale skin, abdominal pain, constipation or loose stools, eczema, bumps on the back of the arms, bumps on the cheeks. And it's with this little boy, his manifestation was constipation, and it can be different in different kids as well as in adults. So we always want to look at those 5 triggers of inflammation, and what they're doing is they're causing inflammation in the gut. That's where we're getting this inflammation between the cells. And the integrity of the cell wall along the GI tract is extremely important in our ability to break down our food, absorb the nutrients, and that's what then creates our healthy cell walls, because we're absorbing our fats and we're absorbing our proteins. And the cell wall is made up of fats. And we want good, healthy cell walls all along the cells of our GI tract, along our skin. And so how do we know if our kids have a leaky gut? Is you're going to just go comb through those different physical symptoms that we've been talking about. And we're going to look at the food too, and we're going to get more in depth about that. But I just want you to understand this concept that it's these triggers are what are creating the inflammation in the gut. The cells are coming apart. Food, proteins, and particles are getting absorbed into the bloodstream. And because we don't have fences in the body, inflammation in one area can be inflammation in any area. I'm going to give you an example of another case that we've talked about already. This was a little boy, 18 months old. Parents came in because his behavior was off the charts and he had eczema. And he would have meltdowns all day long. He just couldn't hold his nervous system together. He couldn't organize his nervous system. They had already taken him off a couple of foods. And so what we did is we just made sure he was off of dairy and gluten. We added in a probiotic. And with getting out the proper food out of his diet and adding in just a probiotic for him, his behavior improved significantly. We did some other things with him, of course, but one of our visits, they were able to go out to eat for the first time because he was able to sit and eat and be with the family. It was impacting their whole family. So that it can be a wide array of symptoms. And that's what I just want you to look out for. The skin is a really good window to the gut. The skin and our bowel movements. I can see a kid with a leaky gut from a mile away. It's that, again, those dark circles, they might be mouth breathing, they might have a chronic runny nose, the bumps. You can imagine me in an airport. I have to keep my mouth closed because I want to tell people, hey, your kid looks like they have a leaky gut, and I think I can help you. So we want to look at the skin, look at the bowel movements, go back through the Bristol stool chart. We want either a snake-like or a sausage-like stool. We want one easy bowel movement a day. And one of the reasons we have such good results with the Healthy Kids, Happy Moms program is because we are always focusing on digestion. Digestion is what is going to help heal the leaky gut and bring those cells together. So it's digestion. And when we hit that sweet spot between food and supplements, we're going to continue that for 3 to 6 months. So I want you to think about healing a leaky gut the same way we heal a sprained ankle. And it's going to take us a good 3 to 6 months until that ankle feels like it's your joint again. And in my experience, that's about how long it takes. And this is another case of one of my little patients. He was a 6-year-old and he came in with croup that he'd been having recurrently since infancy, and he'd been on over 10 rounds of steroids. He was taking an inhaled steroid, and then we'd also use albuterol at times. So that means he also had some wheezing. And a month prior to coming to see me, he also had pneumonia, which means he had a course of antibiotics. So you can see his before and after pictures. He had that keratosis pilaris, that chicken skin, in addition to these recurrent illnesses. And when we are taking all of those steroids, that also harms those nice tight junctions along the GI tract. And it harms that nice mucinous layer. We have the mucus right along our GI tract. So that gets impacted. The antibiotics impact the GI tract. And when we pulled dairy out of his diet, because that was also creating inflammation, and gave him the good supportive foundational supplements, and within about 6 weeks, he was much, much better. And it was a good 3 to 6 months to get that full improvement. But you can see he had the keratosis pilaris on his cheeks, he had it on his arms. Sometimes it doesn't go away completely. You can still see a little bit of the bumps on the second picture, but it improved significantly. And then coming back to my little patient that we have been talking about throughout this course, you can see his face of inflammation and a leaky gut. And then you can see in his second picture, the one that's after 2011, he's got the beautiful skin, the clear tone. And then the fall of 2019, when he's a senior in high school, he has figured out the food combination that he can use to keep his gut inflammation at bay. And for him, his trigger is gluten. And he's the one he came in because he had tics so bad that he pulled a muscle in his neck. And dairy wasn't a big issue for him, but gluten was his main trigger that was creating his leaky gut. So he can do a little bit of it now, but he's got to keep it to a minimum. And how powerful is that for a young person who's going to college to understand how their body is impacted by food? So I'm going to leave you with this concept. Look at the stool, look at the skin, look at the inflammation. And what we know is that healthy cell, healthy gut, healthy child. And if you understand this concept, you're understanding what it has taken me 20 years to really learn and be able to put into practice.